Hi, good evening. My name's Dania Till. I'm a student over at the Southern New Hampshire University. I'm here tonight with my patient. We're going to do a head-to-toe body assessment. So let's get started. So my name's Dania. I'm a student at the Southern New Hampshire University, and I'm going to be your nurse today. Okay, I'm going to perform a head-to-toe body assessment on you. First things first, while I wash my hands, I want you to tell me your full name, please.
James Freitag.
And what's your date of birth, James?
03/17/1988.
Perfect. And where are you at right now?
I'm in the VA in Las Vegas, Nevada.
Perfect, thank you. And what time is it right now?
Evening.
Perfect. And what brings you here today?
I'm going to have you perform a full body assessment on me.
Perfect, thank you so much. So what I want to do first is I want to test your skill for comprehension. So I'm going to give you a paper, and I want you to just read this paper and then follow the instructions. Go ahead and take it and follow the instructions. Easy enough, right? All right. Now what I want you to do is I want you to, from 100, I want you to count backwards by 7.
93, 86, 79, 72, 65, 58.
Dang, I'm impressed. I can't even do that fast. Okay, thank you. So now I want to test your long-term memory skills. So I want you to tell me what you did last year for your birthday.
I was driving a truck in Fresno, California for Producer's Dairy, driving to San Francisco at night.
Oh, okay, perfect. Now I'm going to test your short-term memory. I'm going to give you 4 things to say and remember. First one we're going to say is a tree, a car. We're going to say keys, and let's say lights, okay? Now I want you to count from 100 back from 20s, okay?
100, 80, 60, 40, 20, 0.
Okay, perfect. And now what are the 4 things that I mentioned?
Car, tree, keys, lights.
Very good. So that's your short-term memory. Very good. So now what I want to do is I'm going to kind of inspect your head, go over everything with that, okay, first? If you don't mind, I'm going to check your hair distribution and make sure everything is okay with your head. So everything looks good. I don't see any abnormalities. I do see a little decrease in hair distribution up top. Does that run in your family?
Yes, it does.
Okay. All right. Everything looks good. I don't see any cuts, bruises, moles, nothing. It's nice and round and even. Very good. What I'm going to do is I want to test your temporal arteries. So I'm just going to kind of palpate here for them. Very good. Okay. And then now what I want to do is I want to check your sinuses, okay? So first things first, have you ever had any sinus problems in the past?
No.
Okay. So I'm going to test your frontal sinuses. Does that have any pain or anything?
No.
No? I'm going to test your maxillary sinuses. Do you have any pain here?
No.
No? Okay. Now I'm going to test the nodes, your lymph nodes in your body. Okay, so we're going to start with post-auricular.
No pain.
Okay. You won't feel pain usually. We don't want you to have pain. These are your post-auricular. These here are your tonsillar lymph nodes. I don't feel anything. Your submandible lymph nodes. Your submental. Don't feel anything swollen or anything. And I want to see your supraclavicular. We definitely don't want to feel any nodes here. Okay, everything looks good here. What I want to do now is I want to test your eyes. Okay, so we're going to be looking into your eyes. I want to check your conjunctiva. I'm going to lift your eyes up a little bit and down. You want to make sure there's no infections anywhere. Okay, everything looks good. Your lashes are well distributed. What I'm going to do is I'm going to check your eyes now. Okay, go ahead and look at me. Might be a little bright. So the optic disc looks nice and sharp. I don't see any artery ticks or clicking. Arteries all look well and distributed. wool patches. That's a good sign. I'm going to check this side as well. Let's go ahead and look straight at me. Very good. Don't see any wool patches. I know it can be a little uncomfortable. Nice and sharp optic disc. Everything looks good. So what I'm going to do is I want to check your pupillary reaction here, okay? So bear with me. I don't have a pen light, so this is how we're going to do it, okay? Very good. Nice. So his pupils are equal, round, and reactive, and well accommodated to light. That's what we want. Now I'm going to test your peripheral vision here, okay? So it's called a wiggle test, all right? So I want you to tell me as soon as you see my wiggling fingers, okay? Look straight at me, okay?
See him. See him.
Okay.
See him.
Okay, very good. Now what we're going to do is I want to test your movements, your ocular movements, and this is actually testing your optic nerves as well, okay? So I want you to look straight at my finger, all right, and follow it, okay? To the side, to the side. Very good. Now, normally if we would do an eye chart testing called the Snellen chart, we do not have one of those right now at the clinic. I know he is a 20/20 vision. What he would do is he would read the line that he would see the clearest using both eyes, then he would cover the right eye, read the line that he can see, and then left eye, he can read the line that he can see the most. He does not wear contacts, nor does he wear glasses. He has pretty good vision. Now what we're going to do is I'm going to check your hearing, I'm going to check your ears, okay? So for your ears, I want to look at your ears first, okay? Have you had any earaches or anything recently?
No.
Okay. Just kind of bear with me. I'm just going to tug on your ears here. Alright, so I do see some wax. Definitely get that taken care of. I see the tympanic membrane. It looks great. The cone of light is at the 7 o'clock position. All right, very good. While I'm doing that, I don't see, your ears look good back here. I don't see any lesions at all. Everything is well distributed. I'm going to check your ear on this side now. Any pain?
No.
Okay, so your tympanic membrane looks great. It looks like the cone of light is sitting at the 4 o'clock position. I do see some earwax in here as well. Looks like we can get that taken care of. Everything looks good. Looking at your ears, I don't see any polyps or anything. I'm just going to toss this. Okay, we're going to do a couple hearing tests. The first test that we're going to do is called the whisper test. Okay, I'm going to whisper into each ear something, and I want you to tell me what I said. Okay?
Okay.
So, hope you have a good day.
Hope you have a good day.
Okay. I hope the Rams win tomorrow.
I hope the Rams win tomorrow.
Very good. So now I'm going to do what's called a Weber test. And what I'm going to do is I'm going to put this Weber test, I'm going to hit this, I'm going to put it on your forehead, and I want you to tell me if you hear the sound in each ear or one or the other or both ears, okay?
Both.
Nothing more than the other?
No.
Okay. So now what we're going to do is I'm going to do the rhyme test now. Tell me when you can't hear it anymore.
No.
Okay. And then tell me when you can.
Yes.
Okay, perfect. Tell me when you can't hear it.
No.
Okay. tell me when you can.
Yes.
Okay, perfect. So that is good. Now I want to do is I want to check your nose. Have you had any deviation, sinus problems?
No.
Okay. So I'm just going to check, make sure there's no polyps in there, make sure there's no deviations that you know about. I want you to go ahead, lift your head up. There you go. Okay, everything looks good in there. I don't see any polyps. Do not see any deviations either. Very good. All right. Now we're going to actually test one of your cranial nerves. It's the first cranial nerve. It's the olfactory nerve. I'm going to give you a couple smells, and I want you to tell me what you smell, okay?
Okay.
All right. This is smell number 1.
Citrus.
Very good. As you can see, we have some orange here. Okay, this is the next one. I love my oils.
Peppermint.
That's right. That one's potent, huh? You jumped on that one. Very good. Now I'm going to check your mouth, check all your oral mucosa and everything like that. First things first, I need to get my tongue blade. So we're going to be testing cranial nerves, 9, 10, and 12, okay? So first thing is I want you to open your mouth, say ah. Very good. Stick your tongue out. I'm going to do a gag reflex, okay? Ah, very good. All right. And then now I want you to go ahead and stick your tongue out again. And I want you to move it left, right, up, and down. Very good. Go ahead. I'm going to look at your mucosa here. Oops, sorry. Got a little tongue blade happy here. Everything looks good. He's got nice pink mucosa. I don't see any lesions, no ulcers or anything. Also, next thing I want to do is I want to test some more cranial nerves. So what we're going to do is I want you to first, we're going to test cranial nerve number 5. So I want you to tell me if you feel sharp or dull. Okay, so close your eyes and then tell me what you feel.
Dull.
Okay.
Dull. Sharp. Sharp.
Okay, very good. Now what I want you to do is I want you to clench your teeth really hard. Okay. Very good. Move your jaw from side to side. Very good. Now I'm just going to do a corneal test. This is going to rub a little bit of cotton along your eyes, and you'll probably blink, which is what we want. Okay? Okay, very good. Now we're going to test cranial nerve number 7. So I want you to give me a frown and a happy face. Stick your tongue out at me. Very good. All right. So all that's working well. So now what I'm going to do is I'm actually going to move down to your neck area. We're going to test your heart and your carotid arteries. First things first is I want to check your carotid artery. Very good. I'm going to check your left carotid artery. Very good. It's about a +2 on each side. Just let it normal. I'm actually going to sit this back a little bit because we're going to test your, oops, wrong way. So now what I'm going to do is I'm going to have you, are you okay?
Yes.
Go ahead and relax your head back. And I want you to turn your head a little bit. It's going to be at a 45-degree angle, so that's about it. So I'm going to listen to your arteries here. Okay, go ahead and face me. Very good. Go ahead and relax. I'm going to have you turn your head here. I'm going to, what I want to do is I want to test your JVD. So I'm going to get my tools over here. So we want to check to the sternocleidomastoid right here. And then we're going to look for a little palpation. Very good. I just want to check here. All right, so he's at a 2 right now, which is normal. Nothing above 3 is not what we want. So he's good. He's at a 2 for his JBD. What I'm going to do now is I want to listen to your heart sounds. So first things first, we're going to check your right second intercostal space, and this is going to be the aortic valve. Next one, we're going to check second intercostal space. Left side is going to be the pulmonic valve. Excuse me. This is Erb's point, third intercostal space. Tricuspid, fourth intercostal space.
Uh-oh, low battery. Oh, jeez.
And
Yeah.
mitral valve.
Low battery.
Okay. And then now we're going to check the bell. The bell, this part here, is going to see if there's any extra sounds. Excuse me. If there's low battery on the phone, excuse me while we have technical difficulties. Okay, so now we're going to check the bell. This is aortic, pulmonic.
You're doing perfect.
So we already tested the pulmonic, the aortic, the Erb's point. Now we're going to go to the tricuspid and then the mitral. Sorry about that. I just had a coughing attack, but I washed my hands. All right. So with that, with the bell, I did not hear any S3, S4. There are extra heart sounds, any murmurs. Everything's sounded good for me on that end. Okay. I do want to check your capillary refills. Okay, so I'm going to wash your hands here. So as you can see probably from the camera, his cap refill is less than 3 seconds, which is exactly what we want. Okay. Again, less than 3 seconds, so that's good. Very good. I want to check your pulses on each side. Very good pulses. Check here. Very good radial pulse. Okay, so normally I would check the femoral pulses. I would go here, but for camera reasons, I don't want to do that right now. I do want to check. I'm going to put this up a little bit more comfortable here. Very good. So I do want to check his pulses. Pedal pulses are really good. Posterior tibial, very good. I want to check his popliteal. Popliteal pulses are nice and good, about a +2. Now what I want to do is I want to check your lungs, listen to your lung sounds, okay? So I guess I'll do it while you're laying down. All right. I want you to take a nice deep breath for me. Oh, maybe switch it. Okay. Very good. One more. Very good. Now what I'm gonna push this in and I'm gonna have you actually sit. Okay, we're gonna sit up. I'm gonna listen to your back. Deep breath. Again. Very good. I want to check for fremitus. All right. I want you to take a nice deep breath. Out. Very good. Chest is nice symmetrical. No feelings of fremitus. I'm actually going to do some percussion here. Okay, so just bear with me. Very good. Tympani throughout. I'm going to check here too. Very good. Tympani throughout. Any shortness of breath or anything?
No.
No? Very good. Or do you smoke?
No.
All right. Have you ever smoked?
No.
Oh, okay. Yay. All right. So now I want to check your abdomen. If you want, you can go ahead and lay that down. Listen for vowel sounds. So vowel sounds are active. They're active in all four quadrants. Why I'm here, I want to check his arteries, listen for any bruits, okay, which is not what we want. Okay, so this is going to be his renal arteries. His aortic. His iliac. Iliac. Femoral. Femoral. Very good. So everything looks normal there. I didn't hear any bruits. What I'm going to do is I'm going to do light touch here. I want you to tell me if you have any pain or anything anywhere.
No.
Any pain?
No.
No? Okay. I want to feel your liver here, so I'm going to do a deep palpation, okay? So what I'm going to do is I'm going to press down here, right underneath the rib cage, and you can feel his liver, actually. I do not feel any nodules or anything, so that is good. Spleen is over here on the left side, and if you go on right under the rib cage, you might be able to feel it. So it looks like it's good. Don't feel anything very much, no swollen or anything, so that's a good sign. So go ahead, I'm going to have you sit right here. Okay, you doing okay?
Yes.
All right. So what I want to do now is I want to actually check your skin and everything while I'm here. I want to check your legs here. So I do see on your heels and everything, I do see some dry callous skin. So you might want to use lotion with that every night. Okay. And then also on this side too, I do see some need for lotion, and you have some dry skin. I see a couple scratches here, little scratches here. You've been working out somewhere. Where'd you get poked?
My job calls for it.
Okay. Nothing too bad then?
No.
Nice and good here. I do see a little what looks like appears to be a little mole here in the mid of your back. According to the ABCD rule, we want to check and make sure there's make sure their coloring is good. The diameter is definitely less than 6. The mole is actually, it's not jagged, and there's no difference in color from it, so that's good. We'll just keep an eye on that later on, okay? Everything looks good on your arm here on your right side. I do see what appears to be a pretty large scar here on your left arm. What did that happen?
A car accident.
How long ago?
7 years.
Okay. No other injuries, head trauma, injuries like that?
No.
Okay, very good. I want to test your reflexes, actually, right now while I'm at it. Okay. So first things first, I'm going to check your radial reflex here. Okay. Oops, sorry. All right, we're going to check. Okay. And then we're actually going to check this reflex here. This is your tricep reflex. All right. And we're going to check the radial reflex here. And then we're going to check the reflex here. Okay. I'm going to check your knees here. Very good. I'm going to check your Achilles. Okay. Go ahead. My tool disc. And then now what I want to do is I'm going to check your sensory and your motions and everything. All right, so I'm going to have you actually go ahead and lay back down. Oh, I know it's like up, down, up, down. Lay down. Okay, let's pull this out again for you. A little more comfortable. Okay. So I want you to test, since you're laying down, I want you to test your hips. So go ahead, I want you to bend your knees all the way up to your chest, down. All right, now what I want you to do is I want you to put your leg down to the side of the table. Any pain?
No.
And then up. Same on that side. Pain?
No.
Okay, very good. Now what I want you to do is I want you to bend your knees and then out, extend them out, and your feet. I want you to go down with your feet, up, to the middle, and then out. Any pain?
No.
All right. And I see, have you ever had any joint pain in your knees at all?
No.
No? How about your feet? Any joint pain? Anything in your toes, your ankles?
No.
All your joints look good here. Knees not swollen, so that's a good sign. All right, so what I'm going to do, I'm actually going to have you sit up again. Okay. Ooh, hold on one second. There we go. All right, so now I'm going to test your arms actually now and your shoulders, okay? So I want your arms out straight and then down. Very good. Arms out. Bend your elbows. Out. Any pain?
No.
Now with your wrist, I want you to put your wrist down, up to the middle, and then out. Very good. I want you to go ahead and put your arms all the way up as much as you can. Is there any pain in your shoulders?
No.
Very good. And down. Do a nice shoulder shrug for me. Very good. That's actually testing your cranial nerves as well. Excuse me, I'm having a cough attack. What I want to do now is, it's going to sound funny, but I want you to put your heel to the opposite side and down your shin. This is testing your, very good. Very good. Now what I want you to do, go ahead and stand up. We're going to do a sobriety test. Once you have your arms out, touch your nose. Eyes closed. Out. Very good. I want you to walk to the door. And then back. No dizziness or anything?
No.
Very good. Now I want you to do the same thing, but I want you to do the heel to toe, like if they were doing a sobriety test on you. Very good. Come on back. Very good. Go ahead and have a seat. I want to test your sensory. So same thing like what we did with your face. I'm going to do it with your arms and your legs now, okay?
Okay.
So go ahead and close your eyes. I want you to tell me if it's dull or sharp.
Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Dull.
Try it again.
Sharp.
What's this one?
Dull.
And what's that one?
Sharp.
There you go. Okay, I'm going to put your shorts up a little bit. Tell me.
Dull. Sharp. Dull. Sharp. Dull.
Okay. My trick.
Sharp. Dull. Sharp. Sharp. Dull.
Very good. So, do you have any questions at all? Everything looks really good. Main thing is that I would watch out for is your blood pressure. Blood pressure reading was a little elevated today. So I would just make sure that you keep a daily log of that. Make sure you track it every single day and then take it to your next appointment because they may need to put you on some medication. It's highly critical that you make sure you have a normal blood pressure, okay? Do you have any headaches or anything like that with your blood pressure?
Nope.
Okay. Also, too, your O2 sats and everything is really good. It was 97%, so that everything is well with that. This actually concludes our assessment, so I want to thank you so much for being here with me tonight and allowing me to do your assessment.
You're very welcome.
Thank you.